Let's talk about making great full mouth pre-treatment impressions today. Now, if taking a digital scan is simply not an option in your practice, taking a perfect VPS impression is just as important. Your setup for this impression should include the Capture Soft Putty kit. This is a base and catalyst kit complete with 2 spoons for an even 1-to-1 mixing ratio. A Capture VPS Crown oral set medium body syringeable material, including 2 mixing tips. We prefer these tips to be in the 5.4 millimeter gauge size. Also Capture VPS Fast Oral Set Bite Registration Paste with just 1 mixing tip. This tip we prefer to be in the 6.5 millimeter gauge size. You're going to use a full arch maxillary and mandibular impression tray. Get 4 cotton rolls and a plastic headrest cover or a chair cover with a pretty standard pair of scissors. To get these plastic sheets ready, we're going to cut about a 4x4 inch square out of the folded cover. Now cut each square from the midline of one side to the center of the square. This is just to give the plastic some flexibility to be manipulated during the impression process. Now starting with this lower tray, hand mix a pretty heaping spoonful of both the putty base and the catalyst in equal parts until that mixture is just one solid color. Roll the putty into a cylinder and shape it into that impression tray. Hand form a slight indentation where the teeth will rest. Put one of your pre-cut plastic squares centered on top of the tray with the tongue cut area between these arches. Try to cover up all exposed impression putty with this plastic sheet. Place the entire assembly in the mouth and seat it into place first with hand pressure. Next, place 2 cotton rolls bilaterally at the bicuspid area and ask the patient to bite into them firmly. Manipulation of the lip can aid in the formation of this putty tray. Then after 5 seconds of firm pressure, remove that tray from the patient's mouth. While this putty is still pretty soft, take off that plastic sheet and you can hand manipulate the putty just to remove any potential undercut areas or stretch and mold a more ideal tray shape. Basically what we're trying to accomplish here with this step is the formation of a chairside custom tray. Now start adding the syringeable medium body material directly into the tray while keeping the mixing tip buried. You're trying to avoid air bubbles from becoming trapped. All of this is accomplished while the putty is still curing to aid in the eventual integration of both of these layers together. Now, this entire assembly is now placed back in the mouth and seated just with hand pressure. I'm gently pressing the chin and the cheek area, and that's going to help to flow the medium body material and just to remove any air bubbles that may be present. The most important technique requirement at this stage is to make sure that this tray is held in with hand pressure only. Don't ask the patient to bite on any props to hold this in place. The impression can be removed after it's set and check to make sure everything is in order. The final step requires a bite registration of the patient's arches in centric occlusion. We do recommend the use of the Capture VPS Fast Oral Set Bite Registration Paste, spread out over the full arch, allowed to set, and then removed.